In this video, we're going to be talking about cystic fibrosis. Cystic fibrosis is a genetic disease inherited from both parents. It causes the body to secrete thick and stickier secretions instead of thin and slippery as they normally are. Cystic fibrosis can cause issues within the sweat glands, respiratory system, digestive system, and reproductive system. In some cases, cystic fibrosis can be fatal. It is caused because of a mutation in the cystic fibrosis transmembrane conductance regulator gene. There are about 1,700 known mutations of the gene, and the thick and sticky secretions caused by cystic fibrosis is because of the body's inability to bring chloride to the cell surface. The chloride would bring water. The water would then break up the mucus and would cause the secretions to become thin and slippery instead of thick and sticky, which is what happens in an affected person by cystic fibrosis. So some symptoms of cystic fibrosis are wheezing or a persistent cough that may or may not have phlegm, poor growth or weight gain regardless of a healthy appetite, and because of the body's inability to digest food correctly, people with cystic fibrosis have more bulky stools or difficult bowel movement. People with cystic fibrosis also have extremely salty tasting skin. And another symptom of cystic fibrosis is infertility. Women who have cystic fibrosis are 20% chances of being infertile, and men who have cystic fibrosis are 95% infertile. So the genotype of cystic fibrosis is a recessive C, recessive C. The normal cystic fibrosis transmembrane conductance regulator gene would be an uppercase C, while the mutated would be a lowercase c. So a big C, little c would be considered a carrier of cystic fibrosis. And this is just a Punnett square to kind of explain how cystic fibrosis is passed on to the child. So the phenotype of cystic fibrosis is kind of hard to pinpoint because people who have cystic fibrosis are so hard to tell apart from people who don't. Cystic fibrosis is mainly just a secretion issue, so it's not something that really stands out from other people. I mean, in some cases they will have a barrel chest, which is bigger than the average chest, as you can see in the picture, or clubbed fingers, or distorted nail beds. Labored breathing is kind of just one of the ones that you would almost never notice. Maybe you'd even see it in somebody who has allergies. Cystic fibrosis is a pretty common disease. It affects about 30,000 Americans and 70,000 people worldwide. It is a predominantly Caucasian disease and affects 1 in 3,500 Caucasians, while it only affects 1 in 17,000 African Americans and 1 in 31,000 Asian Americans. Cystic fibrosis, if you both are carriers, your child has a 1 in 4 chance of having cystic fibrosis. Now, if only one parent is a carrier, there's a 1 in 4 chance that their child will be a carrier as well. Sadly, there is no known cure for cystic fibrosis, but there are treatments to help the side effects, such as breathing treatments, airway clearance, and inhalable medicines. If lung dysfunction goes on long term, you can have a lung replacement. There are pancreatic enzyme supplements to help increase the function of the pancreas, and there are fitness plans to help the overall health of people affected by cystic fibrosis. There are CFTR modulators, which can only help certain mutations of cystic fibrosis. Hopefully one day there will be more modulators that can help more mutations that are known. And this is my sources slide. I would like to thank you guys for watching my video, and hopefully it helps you understand cystic fibrosis.